It's Dr. Joan Pastor back again, and in our ongoing series on anxiety that has its roots in some sort of trauma. So, the person is having some sort of symptoms, then that helps them to realize they need to get some help. A lot of times what really pushes people into seeking therapy is actually not the original trauma itself. And it might not even be the ongoing trauma, that they might currently be experiencing. Actually going through it. But it's the after effects. It's what happens as a result of experiencing or witnessing trauma, or after years and years of pushing it down, they can't push it down anymore. So very often we get people come in with depression, with anxiety, with eating disorders, with a lot of compulsions. So they might seem obsessive compulsive about things. And those can all be separate issues of their own, okay? We definitely get people who might have problems with sex and sexuality, especially, of course, if rape was involved, when that's related to the original trauma. So people who've been raped tend to respond in one of two extremes if it's not treated. Either they will withdraw completely and will have problems with intimacy and sexuality associated with intimacy, and even with being touched, or it can go to the other extreme, where they might begin to have sexual relationships with lots of different people, and they just jump from relationship to relationship, in extreme cases, even from stranger to stranger, okay, because in a sense they're reenacting the trauma that was done to them, the sexual abuse that was done to them. So, as you can see, we have our work cut out for us. So one of the things that's very important is that when someone comes in, all good psychologists do a really good, thorough history. We ask a lot of questions, and we're trying to get what's underneath the presenting problem, why you've come in the first place. Now, however we discover that there has been trauma, at some point it begins to become clear that the depression or the anxiety is related back to an event or series of events. And at some point we have to address that. Interesting enough, a lot of people come in for therapy. Actually, the traumatic events are one of the hardest things for them to address. So they're there for help. They want the therapy. On some level they know they have to talk about it, but they're also extremely nervous to talk about it. So in those cases we have to go very slowly. Okay? Now other times we have people who talk about it all the time. They just dwell upon it all the time and obsess. So then we have to use a different approach. The first step, no matter what, is we have to get as clearly as possible what actually occurred. And so a lot of times we will ask the person, it depends. Sometimes most of the time I'll have people write out the event. Now if it was chronic, then before they write out anything, what we have to do is I have to go through with them, and I have to begin to see what different kinds of events occurred. And instead of having them write it out, because writing can trigger too many emotions, just simply going very slow and having them talk about just the key events, or not even talk to me about them in detail, but at least list them, so we can begin to get a list of the different things that happened. And it's interesting because a lot of times I have spouses who, sometimes we have to bring spouses into treatment just in the beginning to help explain, and educate what's going on. And a lot of times spouses don't completely understand. It's kind of like, well, but this happened 20 years ago. How come they can't get over it? Well, the reason why is because they've been running away from it for the 20 years, and now it's coming out in other ways that are dysfunctional, for example, to the current marriage. And so, it sometimes takes some time, especially because with some people you have to go very slowly because it's very frightening to experience. They've had flashbacks, for example, and flashbacks are not fun. It's like having a living nightmare. So, they don't want to have more flashbacks. And I can't potentially prevent that from occurring. So I might have to work with the person first on how to cope with the flashback if it comes up. Some people might have panic attacks. Phobic reactions are common. Okay? I might have to work with them on how to but how to manage panic attacks. So that when we start to work on trauma, if a panic attack comes up or some severe panic, they know what to do. Okay? So there's a lot of work that's involved in the treatment, and it's very individualized and customized. At some point, we have to begin to look at these different events, and sometimes we only have to look at a few events, and that they learn how to cope, they learn how to let go of the emotions and the feelings through our work together, and then the other events begin to lose their steam as well. Most of the time, there's a couple of events that have some core emotions attached to it, especially in chronic abuse. So, for example, we don't have to work so much on the abusive events themselves, but on the reaction, the basic decision that the person made as a child. So, for example, a person who's chronically emotionally abused or physically abused, somewhere along the way they're going to decide, I can't do anything about it. It's hopeless. And so even though they might still continue fighting on the surface, they might even run away, okay? They might even stop seeing those people. They're going to still carry hopelessness inside themselves, which eventually is going to translate into depression. So we have to sometimes get to not even the abusive events itself, but we actually have to look at the messages people have told themselves and the decisions they've made. And that's actually what keeps the trauma going, is what they have told themselves, okay, about themselves, what they're capable of and what they're not capable of, whether lovable and whether they're just simply not lovable ever. Those are the decisions we have to attack. And we have to work with turning around. And we have to connect them to the events where they occurred, and then we have to help them separate the reality of what occurred from what they told themselves, okay, about themselves as a result of these events. And then work with them to separate the two. The actual event, the reality, to make sense of it, what occurred, whether it's chronic or one time, and then what they have told themselves. What they told themselves at the time, the decisions they made about it, and also the decisions they continue to make about it that keeps the trauma embedded. And we work on it through conversation, through positive visualization exercises, through journal writing, through whatever works, role-playing, different responses, until eventually the person begins to integrate the experience and lets it go.